You can run long distances, feel strong, and show no symptoms while a dangerous blockage quietly grows inside your heart. It sounds impossible, but the body can hide serious problems for years without giving any warning signs. Your body's extremely good at adapting. Even when an artery is up to 90% blocked, blood can still flow enough to keep you feeling normal. Everything seems fine, until the moment it suddenly isn't. That is why, for many men, the first sign of heart disease is not pain or discomfort. The first sign can be sudden cardiac arrest. The heart fails without warning because the body hid the danger so well. In this video, we will explore why a heart that appears healthy can still fail. We'll also look at how the body hides these silent threats and the few reliable ways to detect them before it's too late. To understand this, we need to look at the heart itself. The heart is a powerful muscle that requires a constant supply of oxygen to keep pumping blood throughout the body. That oxygen arrives through special blood vessels called coronary arteries. These vessels wrap around the heart like a crown, which is where the word coronary actually comes from. You can imagine these arteries like the root system of a large tree. If a root is damaged or blocked, the branch that depends on it can quickly begin to die. There are two main coronary arteries supplying the heart: the right coronary artery and the left coronary artery. The left one divides into an important vessel called the left anterior descending artery. Doctors sometimes refer to this vessel with a frightening nickname, the widowmaker. The reason is simple. This artery supplies blood to a large portion of the heart's main pumping chamber. If a small branch becomes blocked, only a tiny part of the heart is affected. But if a major artery like this one becomes blocked, the heart can suddenly lose its ability to pump blood to the entire body. But how can such a dangerous blockage form in someone who exercises regularly and feels healthy? To understand that, we need to examine the inner wall of the artery itself. A healthy artery is flexible and smooth, similar to a brand new rubber hose. Blood flows through it easily because the inner lining is slick and allows blood cells to glide past without resistance. This inner layer is called the tunica intima. In a perfectly healthy artery, it stays smooth and intact. But over many years, everyday stress can slowly damage this protective lining. Factors such as high blood pressure, high blood sugar, smoking, and chronic inflammation act like sandpaper on the artery wall. Even decades of heavy physical strain can create tiny microscopic injuries. When these tiny injuries appear, the body immediately tries to repair them. It sends LDL cholesterol to the damaged area, almost like a patch being placed over a crack in a wall. Then the immune system joins the process. White blood cells arrive to clean up the area and deal with the cholesterol deposits forming at the site of injury. Over time, these immune cells absorb the cholesterol and transform into what scientists call foam cells. As more of them accumulate, the area begins to harden. Eventually, this mixture of cholesterol, immune cells, calcium, and cellular debris forms what doctors call plaque. This entire process is known as atherosclerosis. Most people imagine plaque as something that slowly clogs the artery like grease blocking a kitchen pipe. They assume the artery gradually gets narrower until blood simply cannot pass through. But the reality is far more deceptive. As plaque grows, the artery wall often stretches outward to make room for it, keeping the inside passage open and allowing blood to keep flowing normally. This process is known as positive remodeling. It allows plaque to grow silently inside the artery wall, while the inner channel for blood flow remains almost unchanged. Because of this adaptation, a person can have significant plaque buildup while still having normal blood flow. They may exercise, run, and feel completely healthy. That is why someone can run long distances, train regularly, and still have a serious blockage forming quietly in the background. For many people, the body hides the problem so effectively that the first noticeable symptom occurs only when the artery suddenly becomes blocked. So what causes a silent plaque to suddenly turn into a life-threatening emergency? The key factor is the stability of the plaque itself. Think of plaque like a blister under a thin layer of skin. Inside the blister is a soft mixture of fat, inflammatory cells, and other debris. If that thin outer layer becomes weak, a sudden spike in blood pressure or intense physical stress can cause it to rupture. When a plaque ruptures, its contents spill directly into the bloodstream. The body instantly treats this as a serious injury. Platelets rush to the area and begin forming a clot to seal what the body believes is an open wound. The problem is that this clot can grow rapidly and completely block the artery. cutting off blood flow to part of the heart muscle. When the artery suddenly becomes blocked, blood can no longer reach the heart muscle that depends on it. Without oxygen, those cells begin to die within minutes. This event is known as a myocardial infarction, more commonly called a heart attack. The damage happens quickly, which is why every minute matters. But there is another situation where a heart attack can occur even when the artery is not completely blocked. Imagine a healthy middle-aged runner pushing hard during a race. His heart rate climbs higher and higher as his body demands more oxygen. Under normal conditions, the coronary arteries can increase blood flow to meet this demand. But if one artery already has a moderate blockage, the situation changes. At rest, a 50% blockage might not cause any noticeable problem. Blood still passes through the vessel and supplies the heart. But during intense exercise, the heart suddenly requires far more oxygen than usual. The partially narrowed artery cannot deliver enough blood to keep up. This creates a dangerous imbalance between supply and demand. The heart muscle begins to suffer from a lack of oxygen. Doctors call this condition ischemia. When the heart muscle stays deprived of oxygen for too long, the cells begin to die. Even though the artery was not fully blocked, the stress on the heart can still trigger a heart attack. Sometimes another hidden factor can make the situation even worse. One common example is a heart rhythm problem known as atrial fibrillation. Your heart normally beats in a steady, coordinated rhythm. Electrical signals travel through the chambers, allowing the heart to squeeze and pump blood efficiently. In atrial fibrillation, the upper chambers of the heart begin to quiver instead of contracting normally. The rhythm becomes chaotic and irregular. This irregular rhythm disrupts the timing of the heart's pumping cycle. Blood flow becomes less efficient, and the heart must work much harder. If someone already has a partially blocked artery, this rapid and irregular heartbeat can create a dangerous combination. The heart begins beating so quickly that it has very little time to fill with blood between beats. At the same time, the narrowed artery cannot deliver enough oxygen to support the increased workload. This creates a perfect storm where the heart muscle struggles to receive the oxygen it needs to continue working. Doctors often refer to a 70% blockage as the point where symptoms usually begin to appear. Below that level, the body can often compensate. But above that level, simple activities like climbing stairs may start causing chest tightness or discomfort. In younger people, a plaque rupture often happens suddenly before the body has time to build those protective detour vessels. When the main artery closes, there is no backup route for blood to travel. This is why doctors often repeat one phrase in emergency medicine: time is muscle. The longer the heart goes without oxygen, the more permanent damage occurs. After about 20 minutes without blood flow, heart muscle cells begin to suffer irreversible injury. If the blockage continues for 90 minutes or more, a large portion of the heart muscle can die and turn into scar tissue. Scar tissue cannot contract like healthy heart muscle. Once it forms, that part of the heart permanently loses its ability to pump blood. Recognizing the symptoms early can make the difference between recovery and severe damage. In many men, the classic sign of a heart attack is intense pressure or tightness in the chest. This feeling may spread to the left arm, jaw, shoulder, or upper back. Women, however, often experience different symptoms that are easier to miss. Instead of chest pain, they may feel extreme fatigue, nausea, shortness of breath, or even severe indigestion. When these symptoms appear suddenly, especially during physical activity or stress, they should never be ignored. Some people describe a strange feeling of anxiety or a sudden sense that something is very wrong. This instinctive warning can sometimes appear before other symptoms. If a heart attack is suspected, doctors must act quickly to restore blood flow to the heart. One of the most common emergency treatments is a procedure called percutaneous coronary intervention. During this procedure, a cardiologist inserts a thin tube through an artery in the wrist or groin and carefully guides it toward the blocked coronary artery. Using special imaging dye, the doctor can see exactly where the blockage is located inside the vessel. Once the blockage is identified, a tiny balloon at the end of the catheter is inflated to press the plaque against the artery wall. This step helps reopen the passage so blood can flow again. After that, a small metal mesh tube called a stent is placed inside the artery. The stent acts like a scaffold, holding the artery open so blood can continue moving freely.
Once the immediate danger is treated, the next question becomes even more important. How do you find these hidden blockages before they cause a life-threatening event? Most people rely on standard blood tests. These tests measure cholesterol levels and other markers in the blood. But here's the problem. Blood tests only show what is floating in your bloodstream. They do not show what is already building up inside your arteries. You could have normal cholesterol levels and still have dangerous plaque forming silently within your vessel walls. That is why imaging scans are becoming more important in detecting hidden heart disease early. One of the simplest scans is called a calcium score. This quick scan looks for hardened calcium deposits inside the arteries. A score of 0 usually means there is little to no calcified plaque present. But as the score increases, it signals a higher risk of underlying heart disease. Another more advanced scan can actually show soft plaque, the kind that is most likely to rupture and cause sudden blockages. This type of imaging allows doctors to see problems long before symptoms ever appear. The goal is simple: detect the issue early, manage the risk factors, and prevent the emergency from ever happening. Controlling blood pressure reduces stress on the artery walls and prevents further damage. Keeping blood sugar stable helps reduce inflammation and slows down plaque formation. Regular movement and exercise support healthy blood flow and improve overall heart function. The truth is, feeling healthy is not the same as being healthy. Your body can hide serious problems for years without warning you. That is why guessing is dangerous. The smartest approach is to use the tools available and actually know what is happening inside your body. Because when it comes to your heart, waiting for symptoms is often waiting too long.
Look at you, living your life like nothing is wrong. Running, smiling, feeling healthy, but inside your chest, something could already be growing. Silent, patient, waiting. You won't feel it, you won't hear it. And when it finally speaks, it might be the last thing you ever feel. So listen carefully. Don't guess your health. Don't wait for pain. Don't wait for a warning that may never come. Go and check your heart. Because the people who think they're fine are often the ones we lose first. If this opened your eyes, don't ignore it. Like this video. Subscribe and take control before your body makes the decision for you.